Fordham, a psychodynamic author, spoke about autism as autoimmune disease. What do you think about it?
Yes, well, there's two aspects of that. There's the mothers and fathers could have autoimmune disease, and there's been a link in epidemiology studies where it's seen that mothers with autoimmune disease are more likely at risk to have a child with autism spectrum disorders. But there's also evidence that the child themselves could have auto-inflammatory conditions. That means they have inflammation that could affect the brain, or that they have inflammation that creates autoantibodies that can bind onto brain proteins, and that could have an effect on neuronal function. But we're not quite sure what that is yet, and because the age where autoimmunity is usually diagnosed is in the 30s and maybe, I beg your pardon, sorry, 30s and further forward, I'm going to do it again. That we haven't had large enough epidemiology studies to know what those children might be, whether they'll develop autoimmunity in the future. So, I mean, like classic autoimmune disease, things like rheumatoid arthritis or multiple sclerosis and things like that. So, there's a couple of lines of evidence to suggest that parents may have autoimmune diseases and the child might have autoimmune disease. And very, very recently there's been some studies that if a mother has a particular type of antibody that binds to a protein in the fetus, that this can be transferred maybe during pregnancy. And so there's a number of animal studies that we've done looking at primates and also in mice that have sort of shown that a certain select group of mothers, maybe 10%, could contain this antibody that then binds onto the fetus and could affect neurodevelopment.
So
what it will help us to understand is what may be the mechanisms that are underpinning certain autoimmunities in certain children. It may not necessarily be the cause, but it could have sort of effects on their behavior. They could be the ones that have more severe behavior. And if that's the case and there is this immune link, then maybe we can treat, as well as treating the child for sort of behavioral conditions, that you could treat them for the immune aspect as well. So you could give them anti-inflammatories or something that can modulate the immune response, and then combined together that could maybe be beneficial. Or it could take, think of it that the immune system could create a brain fog, and that causes the child not to be able to see maybe things clearly, whereas if you took that fog away, then they may be more likely to be able to, the treatment might be more likely to be more effective.
Okay. And
very hypothetical at the moment. We're doing a lot of studies in the animals, so it would be nice to be able to have a pattern that maybe predicts those sort of things, and then we can maybe think about how we can replace those antibodies or remove those antibodies in the mother. I mean, the trouble is that pregnancy is a very critical time, and you don't really want to do a lot of things to a pregnant lady, because it would, could cause other effects as well. So we have to be very careful about how we talk about that and what the possibilities are. But yes, there's certain things that maybe, there's other links with infection rates. If there's an increase in infection in certain mothers with kids that has an increased risk for a child with autism as well. And so by treating that infection, reducing fever might be a way of being able to minimize that effect. My work, I look at, I've seen links between mothers that have asthma and a risk for children with autism as well. So if we can treat the asthma and make sure the asthma is kept in control, then maybe that could have a big effect as well.
Okay.